Come in.
Hello, Mr. Cloney. This is Dr. Sandesh. I'm the physician for you. So, how are you feeling today?
I'm doing okay, but just tired.
Just tired? Okay. So, as I can see here, you are here for the complaint of fatigue. So, since how long are you feeling this?
Oh, this has been going on for the last year,
Last year? Okay.
or maybe 1.5 years.
Okay. So, in what all conditions, with all activities you are feeling tired?
Oh, everything, doctor.
Okay. Like, what are the things that you were able to do it so well initially, and then now it has changed in the past 1 year?
I was able to play with my kids, and now I'm not able to play with my kids.
Okay. Are you stressed about something?
Not exactly. Just I'm tired. I'm just tired.
Do you feel any shortness of breath when you walk?
No, not exactly. Did you write Doctor 8 p.m.? No. DOCTOR. For fatigue, right? Duration. Is it continuous or not continuous?
So do you feel tired every time, or it becomes better and
So all the time.
it's all the time? Okay. So from last 1 year, how has been the progression of tiredness?
It's getting worse. Why it is important to ask this? Why? If it is a female with the fatigue during the menstrual periods, she will get worse. Otherwise, she will make it. So it is very important to follow the doctor 8 p.m. Whether you know why you are taking or do not know, you still follow the routine. How long? Onset? A year? Is it getting worse? The characteristic, mild, moderate, severe? Time of the day. Only in the morning. So that means what? You did not sleep well. You follow the routine. Whatever may happen, earth may shake. Follow the routine.
So at what time of the day you feel more tired?
In the morning.
In the morning, okay. Any problems with sleep?
Yes, doctor, I snore.
You snore. Okay, and this is going on since how long?
This has been going on for 5-6 years. I have increased weight, and that's why I think I snore.
Okay. So have you ever noticed that you had to wake up at the night to, take the breath?
Like gasping? You mean gasping of breath?
Yes.
I do gasp.
Okay. Do you feel sleepy during the daytime?
Yes.
Any difficulty while driving?
Oh my gosh, I have to pull on the side of the shoulder and sleep for a while. Then only I can drive. I have to sometimes go to the rest area to sleep.
Okay, anything which makes it better?
Just short nap in the middle of the day, I'm better.
Okay. According to you, why are you not able to get a sound sleep? Like what difficulty you are facing while sleeping?
I don't know. I snore a lot, doctor.
Mm-hmm. So what I mean to say is it like the difficulty is you falling for sleep or for maintaining sleep?
I'm able to fall asleep, but I cannot maintain sleep.
Okay.
I get nighttime gasping.
You mentioned that you gained weight. So how much did you gain weight and what duration?
I have gained 50 pounds, doctor.
In how many days or months?
Oh, in last 1 year.
Last 1 year. Any change in diet do you think is causing weight increase?
No, my diet has been same.
Any change in medications?
No.
Are you stressed about something?
No.
Okay. Any fever?
No.
Can you elaborate on your past medical history?
Elaborate me on.
Can you elaborate on your past medical history?
Oh, I snore.
Mm-hmm.
I have some blood pressure issues.
Okay.
And that's pretty much about it. And now this fatigue.
Okay. So you mentioned that you had blood pressure and the snoring issues. So are you on some chronic medications too?
What do you mean by chronic, doctor?
Like any medication you're taking for a long time?
Oh yeah, I'm taking the lisinopril.
Okay. Are you allergic to something?
No.
Did you undergo some surgeries?
No.
Okay. Now I'm going to ask you about your social life. So what do you do for a living?
Oh, doc, I'm a banker,
Okay.
financial analyst in a banker.
Oh wow, you can be a great help to us.
No.
Do you take tobacco in any form?
No.
Alcohol in any form?
No.
Any recreational drugs?
No.
Okay, that's really good.
Did you do any of these things in the past?
And did you do any of things in the past as well?
I used to do alcohol and when I was young, and I used to smoke, but not now. So one of the key points in social history is when you are fatigued and tired and gain 50 pounds, and you're asking banker and financial analyst for how long you have done this job. I just changed the job. You missed the question. That's why I'm stressed out.
Did you say that?
No, I did not say because you didn't ask. You didn't ask whether you have changed the job. You always ask for occupation history. So for how long you have done this? Occupation history for how long? Alcohol, smoking, recreational drug. You're not smoker anymore. You're not drinker anymore. So any of these things you have done in the past? Open-end question, right? Makes sense, right? So you can cut down your questions in one sentence, but you have gained all the knowledge. Yes, I used to do alcohol in the past. I used to do tobacco in the past. Yes, I was something else in the past, but for the last 1 year, I changed the job and got the stress out.
So, from how long are you doing? You are in this job?
So, last 1 year.
Okay, so what were you doing before that?
Oh, I was just a banker in some other bank, and job over there was totally stress-free job. And this now, I became a financial analyst, and though I got, promotion, but this job is tiring and very stressful.
Okay, I see.
And I personally feel this is a reason why I have gained weight. Okay. And I think this is the reason I snore. Do you think this is related, doctor?
The snoring can be definitely related to your increased weight, Yes. So anything, are you up to date on your vaccinations?
Not exactly.
Okay. Anything else you like to add that I missed?
So, vaccination, then what? Yeah. So, vaccination, I'm only 46. Why do you think I need vaccinations, doctor? Oh, this is a protocol. We ask everybody this question.
So basically this is a protocol. We don't miss out on anything. We ask these questions to everyone. Then I'm going to ask you some questions and I'll make sure that I'll keep it confidential. Are you sexually active?
Yes, I'm 46, doctor. Do you think I will live a life of a celibate?
No, I'm just trying to know better. Okay, so it's your sexual partner?
My wife.
Your wife. Okay. So any change are you able to enjoy sex?
Oh, enjoy? Yes, everybody enjoys sex. What kind of question is that, doctor? This is not a right question. Yeah.
Stresses there.
No. Are you able to get erections proper? Are you able to get erections?
No, I won't.
Do you have
it? Stress. Due to stress, whether.
What do you say key? Why do you say key? So, are you able to? Is stress affecting your sexual married life?
Okay, so do you think this stress is affecting your sexual life as well?
Yes, doctor. Sometimes when I'm so stressed, and it's like for months we have not done sex.
Okay. Are you able to get your morning erections?
Yes. Can I suggest you one thing over here? Please practice with cardamom. Please practice with the candy in your mouth. You are still murmuring. And I want you to practice 10 times each line. Pick up lines, write 10, 10, 20 times. Your thought process, you know everything, it is getting jumbled up. Okay? 10, 20 times each line, get it out because you are murmuring. You're a bright kid and I want you to open your mouth completely. Okay? Keep going.
So I'm going to do an examination for you to know better. Any change? Sorry, I forgot a few questions. Any change in the bowel habit?
No.
Bladder habit?
No.
Okay. Any skin changes you have noticed recently?
No.
Okay. Any hair fall?
No.
Okay. So I'm going to do an examination for you so that we better understand what's going on. So what do you do during your leisure time?
Oh, my hobbies, do you mean?
Yeah.
Oh, my leisure time is not existent anymore because when I come home, I'm so tired that I just sleep.
Okay. How's your appetite?
My appetite is okay.
Okay. Maybe some change in that?
No.
Okay. Can you please remove glasses from me?
Okay. So, what do you want to do with the glasses?
I want to check the palate.
What is pallor, doctor?
It's like when the low hemoglobin is there, so we can see the paleness in your eyes, which would be normally red. Can you look up for me? Thank you. Now. Thank you. Can you open mouth for me? Now. Okay.
So you are able to see without the flashlight. Oh, you have an amazing eyes.
Okay. And I need to have a look at your feet.
So can you please remove your socks?
Can you please remove your socks?
Don't do that.
Swelling. I'm going to look for your reflexes.
So when you have taken the history, done the examination, make sure you paraphrase what is going on. What do you think is going on? When you're done, whatever you want to do.
I'm going to listen to your heart.
Keep going, go.
Can you please remove gown for me? Thank you.
So you have to do on the chest.
I'm assuming gown is
You're assuming gown is coming down and this is a part of your skin. Don't murmur. Complete the sentence.
Can you take breath in and hold? Okay, thank you. Can you take deep breaths from me? Deep breath for me. Excuse me for my reach. Thank you. So Dr. Cloney, after knowing...
I'm not doctor.
Sorry. Mr. Cloney, so after listening to your complaints and examining you, I am of the view that the issues of being tired and snoring, this is all related to one syndrome that we call it obstructive sleep apnea. So basically, there could be many causes for it. It could be due to hypothyroidism, or it could be due to your overweight. When we lie
Am I overweight or obese?
uh,
My my BMI is 31.
so you're obese.
Okay.
So, because of the obesity, when we lie down,
Do you think I'm obese?
yeah, the numbers are, reflecting the same. For the normal BMI is between 18 to 24, and your BMI is 31, which comes in the category of obesity.
Oh my gosh, can you give me some medication
Yeah,
for
don't
obesity?
worry. We'll definitely talk about that, and we'll.
Can you give me Adipex?
I think first we'll try without medications. We'll try to make some changes in diet and some lifestyle modification. We'll try to do some physical activity, and I think hopefully that will help you in losing the weight. And then if it doesn't work, then we'll step ahead.
Okay.
Yeah, so I think definitely we'll talk about this thing also. So due to obesity, when we lie down to sleep, so the air, the passage, I'll explain you the diagram.
Do you think my nose is so big, doctor?
Sorry.
This is just a diagram I'm explaining. You don't have to explain. You don't have to draw again. This is just a diagram I'm trying to explain.
Excuse me for my drawing. I'm very poor at drawing.
I hope you're not poor in your diagnostic skills, doctor.
I'm sure I'm not.
Okay.
Okay, so when due to the obesity, the muscle tone, this is the air passage that we have, and the air enters through it into our lungs. So due to some factors like the tone around this muscle is low, or due to the obesity, there is not enough passage for the air to enter our lungs, and due to which you have to wake up at night and gasp for air. For the air, and because you are not able to get the adequate sleep at night, you feel tired in the morning, and you have to take small naps. And as you mentioned, while driving also, you have to even stop sometime and to take nap. So this all is ultimately related to not having an adequate and a healthy sleep. So we'll work on your. I'm also going to run a complete blood count to look for anemia, which can also cause tiredness. And I'll also order a complete metabolic profile to look whether your endocrine numbers are good, or if you have to make some modification according to the results. So you have any questions for me?
So what is the treatment for this, doctor?
Initially, we try to treat the cause. Right now, in your case, I see the obesity is the cause. If that thing doesn't work out, then we have something known as CPAP, that is the continuous positive air pressure device. It's a kind of a device that we'll put while sleeping, and it will be, putting the air in your air canal with some positive pressure, so that the air has no difficulty or obstruction in going to the lungs, and you can have a sound sleep.
So, but doctor, what I read from Dr. Google is that this is a vicious cycle.
Mm-hmm.
So if I'm obese, my obesity can be due to obstructive sleep apnea, and my obstructive sleep apnea can cause fatigue, and my fatigue, I'm not able to exercise, which causes obesity. Do you think that we should treat this proactively and go for a sleep apnea machine?
Yes, that was exactly the next point I was about to tell you, that we're also going to have a sleep test.
Oh, thank you. That's what I wanted. Thank you. That's what I read on Dr. Google.
Yeah, exactly. And you're lucky that we have a sleep lab here, and we're going to conduct the test for you as well. So I'll tell my nurse to schedule the test for you, and meanwhile, if you have any trouble, you can always take my number from the front desk, and you can contact us if you have any problem.
Mm-hmm.
So it was nice meeting you. Have a great day.
But doctor, I do have another question.
Yeah, sure. Go ahead. I appreciate that.
So, doc, is this sleep apnea related to blood pressure also?
Definitely. If the patient who are having sleep apnea, it's usually seen that they are hypertensive. So you are on lisinopril and your present blood pressure is very stable. So right now we are not going to make any modification in the dosage of your hypertensive.
But I want to get rid of this lisinopril medication, doctor. And
Are
Dr. Google told me, I read from Dr. Google that, if I take the sleep apnea machine, I can get rid of this lisinopril. And Dr. Google again told me that this lisinopril also causes this cough.
Yeah.
So I want to get rid of this lisinopril.
Sure, but I think you are not experiencing cough, if I'm not wrong.
Cough is this the
Cough. You're not experiencing cough.
Oh,
right?
no, I don't have any.
Yeah,
You asked me cough. Cough, I have cough over here. Oh, cough. Okay.
Cough,
Yeah.
So anything else you want to know?
I'm just. Oh, yes, I have another question, doctor.
Yeah, sure.
Do you think my erection issues can be due to the sleep apnea?
I think definitely it can be due to that.
But you were thinking, you were thinking something.
Yeah, because before we tell anything to a patient, we should be doubly sure that we are passing on the correct knowledge to you.
Okay. I'm just worried.
So
how do you know that I don't think so. You have done this questionnaire of sleep apnea, which is a stop bang questionnaire. Did you do that questionnaire? I don't see. Did you measure my this thing? You never measured my neck. You never asked me about my neck circumference.
Oh, I think I need to go back to my mentor and ask him because I don't know about that.
Yeah, you have to measure the neck, right? Okay. So sleep apnea. So it was a good presentation. Again, I'm trying to give you a tough time over here. What are the questions in sleep apnea you will ask? Again, everything is written in my book. You have to read. I have vital checklist and road to USMLE. So the questions you are going to ask, how I remember, is with the help of an acronym, snoring nap. S is do you snore? N, nocturia, getting up and peeing at night. O, obesity. R, restless leg syndrome. I, impotence. N, nighttime gasping. GERD, acid reflux. You missed that. N, neck circumference. A, age, above 50 years of age. P, pressure or blood pressure. So when you have a sleep apnea, how is sleep apnea related to this? So you have to understand the concept. So you have this pharyngeal muscles. When you sleep like this, they collapse. So the oxygen cannot enter, carbon dioxide cannot go out. So when the carbon dioxide is high, this causes hypercarbia. This causes morning headaches. This also causes fatigue. This patient is not fresh, right? So when you have low oxygen, high carbon dioxide, what happens is this is your intestine, you are not getting enough oxygen. So because of the receptors you get, because you have hypoxia, right? You have hypoxia. So this hypoxia leads to subplanchnic dilatation, and then because this dilatation happens, the blood pressure slightly drops, carotid receptors are stimulated, stress hormones are released, blood pressure increases, and that is the reason for the high blood pressure. So entire concept, you have to understand the concept, and this is how you're going to present. If you have fatigue can be due to thyroid, fatigue can be due to anemia, depression, restless leg syndrome, which we discussed. Thank you for watching the video,
Enroll now in our Lean Patient Experience Certification course, link in the description below.